This program is sponsored by
Lanka Hospitals. Caring, curing.
Ladies and gentlemen, welcome to another episode of our television's Mediline, where we keep your health at heart. Today, once again, we have a very experienced specialist with us, joining us here at Lanka Hospitals in Colombo. He comes, of course, as one of the pioneers of the opening with this hospital, as well as a lot of international exposure. He's a visiting consultant, a senior visiting consultant who has been here for many procedures as well. And we're pleased to have a little bit of time to interview him today. So let's warmly welcome Dr. Rajesh Fogla.
Thank you.
Good day to you, Doctor. And how are you doing?
I'm doing fine.
Wonderful. So, Doctor,
Good.
we're going to talk about the speciality from your point of view, your background into eye surgeries, as you spoke about. And before that, also just to touch on your background of being one of the first here when Lanka Hospitals first, I think, opened out as Apollo Hospitals.
Yes.
And then you started with being the first to do several procedures yourself as well as the hospital. Could we just talk about that background a little bit?
I started back in 2002 when this hospital was started as Apollo Hospitals. So I was on an assignment here for a year. I started the eye department. And we did bring in a lot of new technologies. We were the first to introduce LASIK in Sri Lanka. We put in the first excimer laser and we introduced the LASIK surgery. In terms of doing the corneal transplantation surgery, times have changed now. Instead of replacing the entire cornea, we replace only the layer of the cornea that's not functioning very well. So we introduced the concept of lamellar keratoplasty also in Sri Lanka for the first time at Lanka Hospitals. And besides that, doing complicated cases in terms of ocular surface reconstruction, treating bad chemical injuries where we have to restore the structure and function of the eye, doing the artificial corneal transplant called the Boston keratoprosthesis. So these were some of the things which we brought in for the first time in Sri Lanka, and we introduced them at Lanka Hospitals.
Right. Doctor, when we talk about, we're looking at a lot of things here with the change of times and procedures. What are the different specific types of surgeries concerning the eye that you specialize in?
The human eye is pretty similar to a camera. So you have the cornea, which is the clear structure in front part of the eye, and then you have the crystalline lens that is inside the eye. These two structures are like the lenses in the camera. They help focus the image or the light onto the retina. The retina is like the film inside a camera. So it's pretty much the function of an eye is very similar to a camera. So my area of specialization deals with the front part of the eye, dealing with mainly the cornea, the cataract. So because any abnormality in these two structures can definitely affect your quality of vision. And if the quality of vision is affected, definitely it affects your quality of life. And in a young individual, it can affect your productivity as well.
Right.
So I think the basic treatment options that we have for various diseases that affect the front part of the eye, we try and treat them with the best of our ability.
Right. And then, Doctor, when we talk about the number of surgeries that you do on average on your visit here, you told me earlier it was about 3 days.
Yeah, because I'm a visiting consultant, I come for 3 to 4 days. We are able to consult maybe about 200, 250 patients. And on an average, we do about 50 or 60 procedures. So laser refractive surgery is also quite popular, where people don't want to wear glasses or contact lenses. So this is a very safe and effective procedure whereby you can correct the refractive error and thereby eliminate the need for wearing glasses or contact lenses. And it's a painless method, so that's also really nice. It helps improve the activities of an individual. You don't need to wear glasses or contact lenses while playing sports, while swimming. Morning when you get up, you can just be like a normal person and not search for your glasses. So that kind of improves your quality of life.
Right. And what would you say are the more complicated procedures that you currently are doing in Sri Lanka, but maybe that you've seen in the past so many years of being here as now coming into a rise, as in
See,
becoming more
in
frequent?
in the entire medical specialty, not only ophthalmology, all other specialties that you see, it's a very dynamic field. It keeps changing with time, and most of these surgical procedures are gradually becoming less invasive. That means we are doing surgeries through smaller incisions, and patients are recovering faster. The hospital stays minimized. So, in terms of even the cataract surgery, if you look at it, it's like a one of the most common surgeries that you perform, and it's become like a daycare procedure. People can uh, walk into a hospital, have the surgery, and an hour later you can be back home, and there are no, you know, so the post-operative restrictions are also less. So it kind of speeds up your recovery and makes you, you know, functional much more quicker
Right.
than before.
And then one last question before we go into our break is when we talk about the age limit where you see the most amount of surgeries being done, where would you
I
gauge that
think
as?
see, if you look at the age factor, you will find that different age groups have different set of diseases that affect the eye. In children, if you see, you may find that uncorrected refractive errors and allergic eye disease, these are the two main things that you see in the younger population. When you come to the mid segment between 20 to 40, I think again the glasses and contact lenses, and sometimes they can have other diseases like keratoconus, which are more common. Whereas when you go beyond the age of 40 and you start going into 50s and 60s, your natural lens inside the eye starts becoming hazy, and that's what we refer to as cataract. And that's the time when people come in for their cataract surgeries. So I think more and more people, because their visual needs are so demanding these days, because you're always on your laptop, computer, mobile. So everybody wants to have a perfect eyesight without having to depend on an external aid. So depending on the age of the patient, we can cater to different surgical procedures to meet up with the patient's expectations.
Right. Thank you, Doctor. So we will take a quick break, but on the other side, we have more questions with Doctor. So please do stay tuned.
This program is sponsored by
Lanka Hospitals. Caring, curing.
Welcome back to our television's Mediline. We have Dr. Rajesh with us here, and we were actually talking about eye surgeries that have been done. Dr. Rajesh specializes, as he said, to all of our viewers listening there, at the front part of the eye. This is where he specializes in several different types of surgeries. On that keynote of the several different types of surgeries, Doctor, can we talk about each of these procedures? What are the developments that have been with them? What kind of people should be undergoing these surgeries in terms of the time frame of the procedures, in terms of what can be done and how it can be done? If we could talk about those parameters a little bit.
See, one of the common procedures that we do is laser refractive surgery, or LASIK, which is a minimally invasive procedure which can eliminate the need to wear glasses or contact lenses. Now, who can undergo this procedure? Anybody over the age of 18 to 20 years where the power has stopped changing can undergo this procedure. However, there are certain preoperative tests that need to be performed to confirm that the person meets all the requirements that are needed for this kind of procedure. And if you're wearing contact lenses, then you need to discontinue them for at least a week before you come in for your eye exam. And the procedure itself is painless. It takes only 5 to 10 minutes to perform. The recovery period is about 4 to 5 days, although the vision improves right from the next day, but you have to take certain precautions for the first 4 or 5 days. And then within a week, you're back to your routine work and you can resume all activities.
And this is probably the most basic type of surgery that we look at in terms of, having to be visually confined and comfortable.
Same thing can be done when you talk about the cataract surgery. Earlier, we used to do the cataract when the cataract is ripe or mature. That means the person is absolutely not able to see, and then we used to go in for a cataract surgery. Times have changed now. Now we dissolve the cataract using ultrasound energy that's called as phacoemulsification. So the cataract is usually performed in the early stage when it starts affecting the vision. It's minimally invasive. And the best part of cataract surgery is that you have a lot of different type of the artificial lens, the intraocular lens that you place inside the eye. And these lenses can also improve the quality of the vision that you see. And there are specialized lenses that can allow you to see both for far and for near. So you can become totally independent of your glasses in the post-operative period. So, and again, when you talk about specialized surgeries like corneal transplants, unlike the earlier corneal transplant surgery where the entire cornea used to be replaced, now whichever part of the cornea is affected, like if the inner layer of the cornea is affected and it doesn't allow the person to see, we can specifically go and replace that inner layer of the surgery. That is something that I specialize in. So we do these surgeries called as DMEC or DSEC. So that's, again, it's a scientific term, but these are specialized surgeries where you don't need to take out the patient's own cornea. You can just go in and replace the inner layer. And there are certain conditions where you don't, the inner part of the cornea is healthy. You need to replace only the outer part of the cornea. So when you do that, because you don't replace the inner part of the cornea, there is no risk of rejection. Unlike a full thickness graft where the inner part also belongs to somebody else, the body can reject the tissue.
Right.
So these are specialized surgeries which have helped us improve the outcome of the corneal transplantation that used to be done earlier. And when you improve the outcome, ultimately it's the patient who benefits from this procedure. And
plus the quality of life.
Absolutely.
And when we talk about these procedures, it's from a layman point of view for me.
Yes.
Like any surgery, when you go into a surgery, there is obviously a time limit on everything. For example, if you went into open heart surgery
Yes.
or keyhole surgery, they say you've added a 10 to 15 years to your life.
Absolutely.
It's just like that with these procedures. I mean, I understand that there's a lot of care, but how long do we think?
See, it's like when people ask, they undergo a procedure, they always feel that you've done a procedure and is it going to last my lifetime? Mm-hmm. But again, aging is something that is not under our control. So basically, when we treat the patient like you do a cataract surgery, you put an implant inside the eye, the implant is going to last you for the lifetime. But there are other changes that happen in the eye. If you're a diabetic, you may be at risk of developing diabetic changes in the eye. So these are things that the patients, even if they undergo a procedure, they need to have this routine eye examination every 6 months to 1 year to ensure that whatever newer developments happen in the eye, they can be identified and they can be treated at the early stage rather than waiting till the disease reaches a very advanced stage.
Going to the state of prevention is better
Absolutely,
than cure.
prevention
always.
is better than cure. So it's like just like you take your vehicle for a service in time so that you don't meet with an accident. Same thing with the human body, not related to the eye, but I think you should go in for a whole body check, and which includes the eye as well. So in the eye, I think the important part that you need to check is you need to check your eyesight to see whether there is any decrease in the eyesight. You need to check your eye pressure, because glaucoma is again another problem where if the eye pressure increases beyond the normal, it can affect the functioning of the nerve. The nerve is that connects the eye to the brain. Mm-hmm. And glaucoma is often referred to as the silent thief of sight. That means a person may have glaucoma, that is a rise in eye pressure, and still be asymptomatic. And sometimes they lose, when the nerve is not working very well, they lose the field of vision. That means the sight vision starts going away. And by the time, if you detect it very late, there is no treatment to bring this back or reverse it. And this can be only seen if you do go for a preventive check. Same thing with diabetes. Diabetes can affect different parts of the eye. It can induce cataract, it can cause glaucoma, it can cause changes in the retina. So these are again something that can be picked up if you go for your routine examination. So I think it's always important that even if you feel that you don't have an eye problem, but you're still going for an eye checkup, just to ensure that you can, if there is anything wrong, you can pick them up at the early stage rather than waiting for the disease to reach an advanced stage.
I think a lot of people have the tendency to be more caring about their vehicles than than the human body itself. This we've seen because a lot of people have the tendency of only running to healthcare when a problem arises, rather than actually taking time to make sure every year that okay, I'm in a good state of mind to not just balance myself and my life, but also the people around me, which is important. On that note, doctor, we look at time. And time has changed from the once upon a time days where life was just so simple and not complex to the current complexity of everything just being technologically exposed, people using different chemicals, women or men, whatever it is, when it comes to hair, whatever. These all have effects. Ultimately, and what are the things that people should actually be very, very concerned and cared about when it comes to the current day, time, and age that seems to be a very severe effect, especially on conditions with the eye?
Yeah, so one of the most common symptoms that patients present with is dryness in the eye or feeling of tiredness. So people come and say, my eyes feel very dry, I don't feel very comfortable. So a normal person would blink at least 15 to 20 times in a minute when you're not doing any specific activity. But when you're working on the computer or looking at your mobile or reading a book, you hardly blink once or twice a minute. And because you don't blink enough, the tear film dries up, and these kind of produces the symptoms of foreign body sensation in the eye, the dryness in the eye, and often it leads to tiredness by end of the day. So I think a change in your activities, if you do any of these activities, taking a break in between after working for half an hour to 45 minutes, keeping your eye closed for a few minutes, maybe doing some warm compress of the eye, hot fermentation at the end of the day, and engaging yourself in some outdoor activity so that your eyes are not constantly focusing at a near object. You have to see, your eyes are not designed to be only seeing for near. So I think these are things that can reduce the strain on the eye. And the other thing that people miss out is that because you don't get your eyes checked, sometimes you may be having uncorrected refractive error, which means that you do need to wear glasses, but you're not wearing them, and then you're creating a strain on your eye, and that can also affect the overall well-being. So I think these are a few things that if people follow, I think it's important, and especially with the kids, because kids these days they are not playing enough outdoors. They're always on their iPads, mobiles, and everything. And studies in Southeast Asia conducted at Singapore and China have shown that these kind of extended near activities often lead to children requiring glasses, especially myopia, the minus power. So I think your parents should encourage their kids to play outdoors and engage more in outdoor sports.
Right. And more towards a final note of all the things that we were going to talk about, Doctor, as a summary. Now, as a layman or an individual, what should the opening signs or symptoms be to tell me that, okay, I should need to come and see an eye specialist? For example, sometimes, like I said, people take the human body and the health for granted constantly. So if they feel a twitch or some sort of, what are the things that would be symptoms to say that, okay, it's time for me to check?
I think if your eyes don't feel comfortable, don't wait for them. Don't for it to get better on its own. Mm-hmm. So this is the era where we try to catch the disease even before it has started. So if you can, because technology is changing the way we practice medicine now, maybe in another 10 to 20 years, you will find that we are treating the disease totally differently, from the era of treating a disease after it has manifested itself and then trying to rectify or correct it. So the treatment is going to change, and we should be able to even detect before the disease has started, and we can try and prevent. And that's the best way, because nothing changes in your body. So if you can prevent something even before it has started, that's happening. A lot of these genetic diseases, so they are now doing gene therapies where they can identify the abnormality right in childhood, and if you can rectify that, you won't even have the disease manifesting itself later on.
Right, so that's wonderful.
So same thing with your eyes itself. I think if you don't have a problem in the eye, but if you still went in for an eye checkup, if your parents had eye disease, like both your parents are having glaucoma, you may be at risk of developing a glaucoma, but you wouldn't know when it's going to start.
It's like a
So
genetic
instead of waiting that only when the disease starts or I have more symptoms, I'll go and visit. I think instead of that, if you just went in for a routine check, I think that would be a real game changer.
Right. And obviously, in today's day and age, even when you take Lanka Hospitals, all the facilities are available. There is the specialization here, there is proper technology, proper equipment. So there is a safety factor and a net for people to actually, engage themselves in the levels of treatment or procedures or even a checkup for that matter, I think.
I think the key word that you mentioned is safety. I think first and foremost, when we treat any of our patients, besides looking at the outcome and what results you can give to the patient, the first and foremost thing is that safety. How safe is the procedure? So we always put the patient's safety first, and then decide whether a procedure is required or not, or whether So I think that makes a lot of difference, because if you want you want to minimize the complications. Obviously, you need to have the best of technology. You need to maintain everything at its peak levels.
That's true. That's understood, actually. Thank you so much, Doctor, for spending your time with us, and most importantly, for enlightening us with the amount of knowledge, especially, I think, to everybody out there, because it's one of the most common things that people do go through. I think enlightenment is the key factor, as well as the education of what you should do and what can be done and how you should take your life forward. So once again, thanking Dr. Rajesh. We thank you, ladies and gentlemen, for joining us on yet another episode of our television's Mediline, right here with Lanka Hospitals. All your medical needs, all your specialities, all the procedures, you can have it all right here under one roof with the best of specialists, with the best of equipment, technology, as well as your safety at heart. Join us again for another wonderful episode on our television's Mediline.
Lanka Hospitals. Caring, curing.